In times of mass hysterias, the human mind goes on witch hunts for information that fits the narrative. And under this circumstance, people tend to believe any nonsense as long as it validates some notion they nourish. At this very moment, the news of the new coronavirus, also known as COVID-19, is sending shock waves across the whole planet. Fake news stories have been circulating the internet, pointing people to cures for the new virus, sharing advice, and some even faking government announcements. The World Health Organization has said this week that fake news about the virus is even spreading faster than the virus itself. Now, at a time like this, when the world is not just fighting a pandemic, but also an infodemic, here are some analyses you won't find in the apocalyptic mainstream media narratives. I'm Sunday Christopher AIMUAMWOSA. You are welcome back to Prime Reporters TV. As the new coronavirus COVID-19 continues to spread around the globe, so does misinformation, fear, fake cures, fake news, and malicious hoaxes. And all these have incited mass hysteria and panic across the globe. On March 11, the World Health Organization, WHO, upgraded the status of the new coronavirus outbreak from epidemic to pandemic. Now, people are petrified with fear. Many are panic buying and stocking stuff at home. Toilet papers and some foodstuff are already out of stock. Some of my viewers have reached out and asked me to fact check some of the myths and misinformation around this topic that is spreading like wildfire on social media, while others just wanted to know what the media isn't saying about the COVID-19 outbreak. So in this episode, we are going to be talking about the new coronavirus, also known as COVID-19. We will be looking at what it is and what it is not. Then debunk some myth circulating in social media on how to either avoid or cure the virus. The many things we hear or know about the coronavirus crisis make us feel so helpless. As at March 18, for instance, the new coronavirus has affected over 167 countries and territories around the world, and one international conveyance, the Diamond Princess cruise ship that is harbored in Yokohama, Japan. At the time of this report, there are 199,409 cases globally, with 7,997 deaths and 82,812 recoveries. But as the number of cases continues to rise, fear and panic have become the order of the day. And while the US, UK, and EU are banning events, closing schools, and sealing borders to slow the spread of the virus, the number of cases keeps increasing in a geometrical progression. Everyone is so terrified that even the Queen of England had to flee Buckingham Palace to get herself out of harm's way. And the one that strikes me the most is when a coronavirus conference that was slated to hold last Friday in New York was cancelled because of coronavirus. Like, seriously? But on a serious note, the coronavirus outbreak might be the first time people are really terrified and afraid for their health and subsequently for their lives. I'm not downplaying the seriousness of the virus, but in as much as it's crucial to put the risk into perspective, it's also important to understand that fear is almost as great a threat as the disease itself. When we cling to our fears, it causes us to give away our powers and make us more vulnerable. And contrary to some media outlets causing undue alarm and panic with ominous headlines, the new coronavirus outbreak isn't the zombie apocalypse yet. So, catching the coronavirus isn't a death sentence. But what exactly is the new coronavirus? The new coronavirus, also known as COVID-19, is a new coronavirus that has not been previously identified in humans. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases. Dozens of viruses exist in the coronavirus family, but only 7 afflict humans. 4 are known to cause mild colds in people, while the other 3 are more deadly and thought to be transmitted from animals like bats and camels. The new coronavirus was first identified in Wuhan, Hubei province in China in December 2019, hence the term COVID-19. In February this year, the World Health Organization described the reaction to the new virus as an infodemic. It defined the term as an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guardians when they need it. Social media platforms such as Facebook, Google, and Twitter have also been aiding in the effort to contain the spread of inaccurate information by removing such content from their sites and promoting trustworthy sources. So, let's take a look at some of the myths about the new coronavirus as requested for by some of my viewers. There's a hoax claiming to demonstrate the correct way to wear a disposable surgical blue and white face mask. It was published on Facebook on January 22, 2020. The post claims that the colored side of the mask should be shown if the wearer is infected with the disease, while the white side should be visible if the wearer is not sick. The post also said that this will enable the mask filter to stop the transmission of germs effectively. But according to the World Health Organization, this is not valid. There is only one way to wear a surgical mask, and most surgical masks are colored on one side to make it easier for medical staff to figure out which side faces out. Whether they are colored blue, green, or pink, the colored side is meant to face outwards. Besides, the World Health Organization recommends masks only for those who have already tested positive for the coronavirus and are displaying symptoms, and for those in direct contact with someone who may have the virus. So the myth is not true. The Facebook post claiming that consuming alcohol is an effective measure against the coronavirus is false. The post contains a screenshot with an image of Worth Blitzer, a CNN's lead political anchor, with the text, "Alcohol kills coronavirus," on the lower third. The news that alcohol kills coronavirus can't be found on the CNN website, and it has not been reported by any credible news source. A reverse image search led me to many other versions of the same screenshot, but with different texts. The screenshot is not true. The myth is not true. The screenshot is as fake as the myth itself. While the coronavirus has been diagnosed in all of the continents except Antarctica, some people on social media still believe that black people are immune to the virus. As at March 11, before a Hollywood actor, Idris Elba, tested positive, a lot of black people across social media had taken notice that there hasn't been a single announcement of a victim, whether fatal or otherwise, being a black person. Calling it so many stupid, ridiculous conspiracy theory and the quickest way to get more black people killed, the actor condemned the myth that black people are immune to the virus a day after he announced that he had tested positive. So there is no evidence to say that black people cannot get the new coronavirus. This is a myth. Anyone can get the new coronavirus, and gargling warm salty water, taking vitamins, or hitting your nasal passage won't eliminate the virus or keep it from reaching your lungs. There is a post attributed to a Stanford Hospital board members circulating on social media with the speed of light. The post claims that if you drink water every 15 minutes, the virus will go down through your throat and into the stomach. And once there, your stomach acid will kill the virus. But if you don't drink enough water regularly, the virus can enter your windpipe and then the lungs, and that is very dangerous. Well, there is no current scientific evidence behind the claim that drinking water every 15 minutes will flush the virus away. According to Dr. Melanie Graber, you cannot flush out the virus from your airway by drinking water. The idea that drinking water will flush the virus into your stomach where it will be killed is not based on any scientific fact. But however, she advised that staying hydrated can keep your immune system strong. Moreover, Stanford confirmed that the message did not come from the university, so it's a myth. And this is all I can take or answer in this episode due to constraints of time. I know you still have a lot of questions. Please leave them in the comment section below or reach out to me and we will find accurate answers to them. But before you go, here are some important tips. According to the World Health Organization, there is no current vaccine to prevent coronavirus, but you can reduce your risk of infection if you 1. Clean hands frequently with alcohol-based hand rub or with just ordinary soap and water for 20 seconds. Cover your nose and mouth when coughing and sneezing with a tissue paper or a flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. Social distancing. This means avoiding crowded places and maintaining distance from others when possible. So that's all for this week, and I hope I was able to answer some of your questions. If you enjoyed this video, don't hesitate to like and share. And if you have anything you want to talk about, anything, just leave your comment below in the comment section and I will answer them as fast as I can. And don't also forget to subscribe and hit the notification button. Thank you and see you next week.